Welcome to the BHC Health Profile tutorial. This tutorial will guide you on how to use the dashboard to obtain the profiles for your specific BHC community. In order to access the profiles, you need to click on the URL located below. Once you click on the URL, you will be directed to Building Healthy Communities Health Profiles webpage. The webpage will give you access to a drop-down menu that lists each BHC. For today's example, let's go ahead and choose Long Beach. Once you have chosen a specific BHC community, you need to click on the button that says Create Profile. Once you do that, the estimates get loaded. Each BHC profile includes a set of indicators, and all indicators are located into different categories or topics. You will notice at the top you have a few tabs: Community, Access to Care, Health Conditions, Food and Exercise, and Neighborhood. Looking at the Community tab, you find a map. This map shows you the boundaries of the specific BHC community, and in this case, Long Beach. You can always zoom in and you can zoom out to get to see really where the BHC community begins and ends. On the right-hand side, you also have a race and ethnic breakdown. As I hover over these squares, it provides me the proportion of different race and ethnic groups. Long Beach has 65% Latinos, 6% whites, 15% African American, 11% Asian, and 3% other or two or more races. As you scroll down, you also get to see different community level indicators, things like unemployment, low income or poverty, less than high school education, as well as limited English proficiency rates. In 2015, CHIS yielded a question on whether or not the respondents ever heard about the BHC program prior to the interview. This question was asked solely for informational purposes and has no bearing on the health estimates generated. The dashboard that you see here also gives you access to that information. So at Long Beach, an estimated 13.4% of respondents reported to having heard of BHC prior to the interview. Moving ahead to the next tab, Access to Care. The charts at the top focus on doctor visits and delays in getting prescription drugs, as well as medical care and insurance status. These are predefined charts. We now see a table. The table provides estimates for both the BHC community, the respective county, as well as the state. As you scroll to the bottom of the page, you find some additional information. The asterisk denotes a statistically significant difference from the corresponding BHC site estimate. And when an estimate is unstable, we generally recommend interpreting it with caution. Moving ahead, if you look at Long Beach, you find that an estimated 32.6% of adults reported to not having visited a doctor in the past year. This is an estimate. Estimates are representative of the eligible population living in each BHC site, and in this case, Long Beach. Immediately below the estimate is the confidence interval, and this is a 95% confidence interval. The confidence interval provides a range in which the true proportion lies. We are 95% confident here that the actual point estimate lies somewhere within the range of 22.5 to 42.7. Additionally, when we look at the corresponding county, that's LA County for this particular indicator, we find that an estimated 21% of adults reported to not having visited a doctor in the past year. The asterisk above the estimate denotes a statistically significant difference in this particular estimate when compared to the corresponding BHC site estimate. Additionally, when we look at the state of California, we also notice that an estimated 19.5% of adults reported to not having visited a doctor in the past year. The asterisk above the estimate also denotes a significant difference in this particular estimate when compared to the corresponding BHC site estimate, telling us that there are significant differences in estimated rates for this particular indicator pertaining to doctor visits. As you scroll down, you also notice that these indicators are divided into age groups. So we have indicators for adults that we just seen now, as well as for children and teens. As you click on the children and teens box, you find that the indicators get populated, and the tabs also have the same format. health indicators for adults, and health indicators for children and teens. Moving on to the next tab, health conditions. We find predefined charts for obesity, overweight, as well as rates pertaining to asthma, diabetes, blood pressure, and so forth. We find that we also have the same indicators populated for children and teens. Moving ahead to the next tab, food and exercise, we find predefined charts for soda consumption as well as fast food consumption. If we look at fast food consumption at Long Beach, we find that an estimated 37.4% of adults reported to have eaten fast food 3 or more times in the past week. And we are 95% confident that the actual point estimate lies somewhere within 26.9 to 48. Additionally, when we look at the corresponding county, that's LA County, we find that an estimated 28.1% of adults reported to have eaten fast food 3 or more times in the past week. When we compare this to the state of California, we find that an estimated 23.9% of adults reported to have eaten fast food 3 or more times in the past week. The asterisk above the estimate denotes a significant difference in this particular estimate when compared to the corresponding BHC site estimate for this particular indicator. So we can actually see a nearly 10 percentage point higher rate of fast food consumption when the BHC site is compared to the corresponding LA County, as well as an approximately 15 percentage point higher when the BHC site estimate is compared to the state of California for fast food consumption. This particular difference is very useful in generating community needs as well as for motivating individual and community-wide health behaviors. Moving ahead to the last tab, neighborhood. In this particular tab, we provide quite a number of indicators pertaining to neighborhood safety and neighborhood perception, fruit and vegetable consumption. As we scroll down, we can notice that at Long Beach, an estimated 64.6% of adults reported to having felt safe in their neighborhood, whereas in the corresponding county, you find that an estimated 84.4% of adults reported to having felt safe in their neighborhood. The asterisk above the estimate denotes a significant difference in this particular estimate when compared to the corresponding BHC site estimate, denoting a significant difference in how adults feel safe in their neighborhood when the corresponding county is compared to the particular BHC site. Additionally, when we also look at the state of California, we find a significant difference. And this is denoted by the asterisk, indicating that there's a significant difference in this particular estimate when compared to the corresponding BHC site estimate. This information is particularly useful when we want to look at how adults perceive safety in their particular BHC site and how the estimate looks different when it is compared across the county and the state of California. Moving ahead, you could also click on the Help tab. By clicking on the Help tab, you will get some additional information on how the data was generated and how you could use the data further for your community needs. In order to create a report, you need to click on the Create Report tab. By clicking on that, you will get a window that opens and allows you to specify 3 different highlights. You could choose a health highlight like the one that you see on the screen. These are just text statements that were based on the data where we found significant differences in the Long Beach BHC. We've highlighted them and we have the ability to include them on the front page of your customized PDF document. Additionally, you could also choose various other highlights. You could choose a race and ethnic breakdown, a combination chart, or your topic chart for your other highlights. The race and ethnic breakdown provides the race and ethnic breakdown makeup of that community. You could also choose a combination chart. These charts are 3 different charts that allow you to combine 3 different custom topics of your choice for each indicator. So, moving ahead, for Long Beach, if we were to choose 3 different indicators, we could choose a different set of indicators based on the drop-down menu that lists the various indicators that you see on the screen. For Long Beach, let's go ahead and choose diabetes levels for adults. Let's choose food insecurity for adults And let's go ahead and let's choose uninsured level for adults from the age group of 18 to 64. You will find that the table gets populated on the right-hand side based on the indicator that you have chosen. Additionally, for your third highlight, you could also choose a combination chart or you could choose a topic chart. Topic charts are just combinations of indicators by topics. So if we wanted to look at neighborhood perception for adults, we could go ahead and choose that as a topic chart. This gives you estimates for the particular BHC site, the corresponding county, and the state of California, and helps you make better decisions based on these estimates on whether neighbors are willing to help each other, whether neighbors can be trusted, whether neighbors get along, and whether neighbors look out for their children. Once I have my highlights ready, I will click on the tab that says Build Report. And as soon as I do that, the system will begin building the report. You will see a progress chart that lets you know the system is pulling the data, creating the charts and graphs into a PDF document. Once it's ready, you find the button that says Ready, click to download. Once you click on that button, a PDF document gets generated. This PDF document contains the customized health highlights that you have chosen for your particular community. As you can see, the front page contains the 3 customized highlights: the text statements, the combination chart with the specific custom topics of your choice, and the topic chart. Because I chose to include all these different tables, I get access to every single indicator that I have available for Long Beach BHC, starting from access to care, health conditions, neighborhood, as well as the same tabs repeated for children: access to care, health conditions, food and exercise, and neighborhood. The final page contains some information on the data collection process, as well as key definition of some key terms that were used in the making of this PDF document. I hope you find this tutorial useful and you will use the information in these health profiles to create customized PDF documents, to inform policies, offer evidence for advocacy, and to motivate individual and community-wide health behaviors in your particular BHC community. Thank you so much for watching this video.